Ruby.
And on matters health, the Council of Governors is raising a red flag over an alleged plot to sneak back the health function to the national government through what they term is a well-calculated smear campaign to paint the devolved unit as inept. Consequently, the county bosses have also faulted the national government for allegedly denying them their equitable share revenue a few days to the end of the 2023-2024 financial year, which they say is hampering service delivery. Here's Innocent Aguero with this report.
Led by COG Health Committee Chairperson and Tharaka Nithi Governor Muthomi Njuki, the governors questioned the motive behind the push. Yet it is the national government that has not released the required resources to counties.
If the Treasury was giving counties their money as is stated in the law on the 15th of every month, I can assure you that there is no county that will be having any debt to KEMSA by the end of each month. And therefore, I urge the Treasury to release the funds for the counties, all that is owed to them, and I would ask the KEMSA to check their accounts at the end of the month when that money has been released.
According to Governor Njuki, the talks around the debts owed by counties to KEMSA had the hallmarks of a well-thought-out and executed scheme keen on painting counties in bad light.
The counties usually pay their debts to KEMSA, depending on the age of the debt. And it's also important to note that there is no county that usually buys from KEMSA upfront. It's always a debt, and therefore there's nothing wrong with having a debt. The problem is when the debt accumulates beyond the 90 days.
As it stands now, counties have not received the equitable share from the national government for 3 months, including June. Yet the IFMI system reportedly slows down from the mid-June.
You need also to support our efforts to collect more taxes and more revenues and to make sure that everybody pays. The counties should be able to help us because that way we can be able to collect more.
There has been a clamor by some officials at the national government to take over the health function and manage it from Nairobi, as was before the advent of the 2010 constitution, but governors have stayed put, variously expressing gains made under devolution.
We have had a long discussion over the division of revenue. The Council of Governors was asking for about 425 billion shillings. The Commission of Revenue Allocation was proposing 407 billion. While the National Treasury was proposing to upgrade from the current 370 billion to 380 billion. We have not been able to reach a decision.
Governor Njuki further noted that counties will clear debts owed to KEMSA immediately after they receive their share of revenue, but the COG also reminded the national government to settle the 2 billion Kenyan shillings pledge to KEMSA to capacitate the medical agency.